Hello, I'm Dr. Eric Ruhland from the St. Paul Pet Hospital. It's March in St. Paul and we're celebrating Heartworm Awareness Month. And as many of you know, at St. Paul Pet Hospital, we actually have a couple different ways that we can prevent heartworm disease. The two most common ways are oral monthly heartworm preventatives that are given, and by far and away the most common way that we give heartworm prevention here at St. Paul Pet Hospital is an injection known as ProHeart 6. It's a 6-month-long injection that your pet can receive twice a year, and it's extremely effective because we don't have to remember to give the monthly preventatives, and that's a huge portion of why we have heartworm disease prevention fail, is this lack of compliance. And it's not because people aren't bad or aren't good owners. Life happens and we forget. So at the hospital here, we almost always recommend, unless there's a medical underlying issue, we will recommend that they receive Heartworm 6 as our heartworm prevention of choice, mainly because of efficacy and ease of administration, and it's one less thing for you to remember. So typically we will test all of our dogs in the spring. Heartworm disease obviously occurs in Minnesota. We see plenty of it. It's carried by mosquitoes. It actually, when a mosquito takes a blood meal from your dog, it can burrow, this little larva can burrow into the skin and goes directly to the heart and forms these big worms. It is a debilitating, lethal disease. We can treat it in dogs, although it's not very, the treatment is pretty risky and it's obviously very expensive. It's much cheaper to prevent a dog from developing heartworm disease than actually treating the syndrome itself, and it provides permanent damage to those pets. So that's in our dogs. We treat them with, like I said, those two types of heartworm preventatives. And recently, as of last spring, the hospital switched our flea and tick preventatives away from a topical agent to a orally administered product called preventative, and that's given every 3 months. And that actually makes it really easy. So a lot of our patients come in, they get their ProHeart 6 injection, and then we actually give them 2 pills of Prevecto. They just give that every 3 months, and then they're done with that and they come back in again. It's incredibly easy for everyone to remember. For me, I know, like I said, life gets in the way, having a young family and everything else that happens. I only have to remember to give my dogs their Prevecto or their flea and tick prevention every 3 months. So that's, from St. Paul Pet Hospital's point of view, that's our easiest way of remembering. Pet ownership should be stress-free and fun, and that makes it the simplest and the most effective from our end. That's what Dr. Melinda and I have chosen and what we've been using now for quite a while. Any questions, feel free to give us a holler here at the hospital. Again, I'm Dr. Eric Ruhland from St. Paul Pet Hospital. We are kind of honoring Heartworm Prevention and Awareness Month in March. And hopefully we got some warm weather coming here in St. Paul in the next couple weeks, and we will see you around the great city of St. Paul soon. Thanks much.